Good morning. It's Thursday, March 4th. Welcome to The Doc is In, Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. Very happy to be here with Dr. Allison Arwady.
Good morning.
Your Commissioner for the Chicago Department of Public Health. This is where you get your questions answered and all the latest information and data on COVID and vaccine in Chicago. We want those questions, so put them in the chat box below. You can also send them using the hashtag AskDrArwady through Facebook and or Twitter. So let's check our distance.
Looks good.
Yes, there's so many things that we have to keep doing.
It's true.
Even with the arrival of vaccine here, and keeping our distance is one of those important things. Hey, I imagine you have lots to share.
There is a lot to share, for sure.
So I'm going to let you get to it.
Let's start with a quick look at the dashboard. As always, chi.gov/COVID- will take you there directly. And when we pull it up here, first, right at the top, you see we are still sitting at that 2.9% positivity. Really pleased with that. It is the lowest that we've been since COVID got here, and it's been holding steady. You can see we're doing about 11,500 tests per day. That is up about 10% from a week ago. And then our cases in that setting are still sitting under that 300 mark, still not down under the 200 mark, which is where we want it to be. And they actually are up 9% from a week ago. But that's consistent because the testing's up 10%. We sort of expect the cases to go up really in proportion to each other. They're parallel. So in effect, this is flat over the last week, I would say broadly. And flat is good. Down is even better, but flat is good. And given that all the indicators continue to head the right direction, mostly I really want those cases to keep going down, and that's where we need people. We're seeing really good impact of getting vaccination into some of the highest risk settings, but we do really need people to keep doing these things that work. We're not going to be Texas. Let's also take a look at
Okay.
Do you know what I'm referencing?
No.
Oh, maybe not everybody knows what I'm referencing. So yesterday, the governor of Texas said that Texas was no longer going to have people wear masks and was going to completely open everything at 100% capacity.
Got it.
And I will just note that Texas has all 5 of the known COVID variants of concern, has, case rates that are well above what we're seeing here, that have vaccine rates sort of below the national average. Not a time to be saying don't wear masks. Right. And it's been an interesting conversation because many of the national companies, Target, Starbucks, have said people need to continue wearing masks, even in Texas. It frustrates me a little bit where this becomes this sort of political statement as opposed to something that people are recommending just to protect themselves, right? This is not for, we are making such good progress, right? Just getting some more folks vaccinated, getting over this, not letting the variants take hold is just really critical. So that was what my we're not going to be Texas comment was.
Got it.
Let's also take a quick look at some of the vaccination data, just because I know not everybody always knows where this is. So you can click you can also get here directly on chi.gov/COVID-vax. And when you pull this up, you'll see sort of what our daily vaccinations look like. The purple are total doses, Chicago residents and non-Chicago residents. You can see we've done more than 683,000 COVID vaccinations here in the city of Chicago. That's more, and there have been more than 80 million done across the U.S.
Wow.
And all is well. We've not seen surprises in terms of unexpected side effects. We've not seen concerns related to safety. The efficacy data, the protectiveness data of this, which is just starting to emerge, is also really looking consistent. We saw here, for example, that we're already starting to see the impact in some of our skilled nursing facilities and nursing homes where early vaccination got in, where we continue to see cases. The majority of those are people who chose not to get vaccinated. So the vaccine continues to perform really well.
That's exciting, and it's also just really interesting how we can be monitoring the impact by looking at our own data.
That's right. Yeah, and we absolutely can. And even some of the improvements that we've seen, I think we shared some of this on Tuesday, at least briefly, but the fact that we've seen cases in particular go down a lot and the most in some of our hardest hit communities. So, for weeks and weeks here, Latinx Chicagoans have been really leading in terms of what in terms of case rates. And over this last month, there have actually been more cases in white Chicagoans than there have in Latinx or Black Chicagoans. More consistent with our population, right? There are more folks who are white, non-Latinx in Chicago. So it's been good to see some of those disproportionate impacts starting to come more in line. And some of that is because of the work of, Protect Chicago and getting vaccinations out, and people continuing to be really careful in these hard-hit areas.
Yeah.
Maybe we'll look at one more data point here, this administered by zip code data. So this is where you can click, this gets updated every day, and you can see where in Chicago the most vaccinations have happened. And so where we pull this map up, what you can see is that if you've been following along with us for weeks, really this northwest section and this southwest section have been our hardest hit areas really for months and months in terms of cases. And the good news is those zip codes are now in the top quintile. The most vaccines have been given in those zip codes. And if you pull up the legend, you can see more than 10,000 zip codes, first doses, but between 10 and 14,000. And then we still have a ways to go in terms of percentage, but it's been good. And that's you've been doing a lot of work on Protect Chicago Plus. So.
I've been doing a lot of work on Protect Chicago Plus, but I also want to just lift up all of the other folks who've been doing work, our provider partners who've been wonderful, including folks like Esperanza Health and Lawndale Christian Health Center. Our community-based leaders from organizations like Northwest Side Housing Center and SWAP and so many others, Austin Coming Together.
Yeah.
I mean, it is a collective effort.
It is.
To just vaccinate as many community members as we can in these communities that have really borne the burden of this virus. So it's exciting to see that data.
It is.
It's very rewarding.
Yeah, so still a ways to go. We are at 1 in 8 Chicagoans. We may get to 1 in 7 today, have gotten at least that first dose, 1 in 3 over 65. Further to go in some parts of the city than others. But again, last week we had the majority of vaccine going to Black and Latinx Chicagoans, which we've hit 3 weeks in a row. And given the disproportionate impact, we're really, really pleased, and thanks to everybody who's been working on that. Yeah.
And we're seeing a lot of good uptick, with our long-term care facilities too. Right?
Yeah, that's right. We've been seeing, as there are these strike teams, right? These mobile vaccination teams that started really with pharmacies as part of the federal pharmacy partnership, and they bring vaccine, and then they bring a second dose, and then there's actually a third visit. And so we've been seeing folks, both residents and staff, who maybe did not raise their hand on that first visit back in December or January, now saying, you know what, I'm feeling more comfortable. I know people who have been vaccinated. I've seen that there have not been major safety concerns, and that I'm in a higher risk setting, choosing to get that first dose in those later appointments. So we're really pleased to see that. And just a reminder to everybody that we want folks to really get the vaccine, feel confident in getting the vaccine as soon as they have the opportunity. But if you are eligible, for example, in 1A, if you were a healthcare worker and maybe didn't make that choice at the moment, you are still eligible, and we still definitely want to get you a vaccine. And that's going to remain true as we continue to move forward. You don't lose your eligibility. Yeah.
Okay. All right. Well, as you can imagine, there are lots of questions about the United Center mass vaccination site.
Yes.
So questions about how to register, also questions about what vaccine is going to be used there.
Okay.
So, I know that you are probably prepared to walk us through how you actually get an appointment.
Yeah, absolutely. So the United Center, which is by far the biggest mass vaccination center that the city of Chicago has had yet, is opening next week, but registration for appointments opened this morning. This is a federal site. It's federal additional COVID vaccine, 6,000 doses a day, which is in addition to what the city of Chicago has been receiving. It's been in addition to what the state's receiving. And just for some context, last week we still were getting about 8,300 first doses a day to go across the whole city. So adding 6,000 a day is a big new bolus of vaccine. Really excited about that. We're working in partnership with the state and with the county, and so these appointments are open to anybody over the age of 65 who lives in Illinois.
Yeah.
We had somebody call yesterday who said, I used to live in Chicago, now I live in Canada, can I come get vaccinated? We said, no, you've got to live in Illinois to get vaccinated. But yeah, let's pull it up. So it opened at 8:30 this morning. Huge rush of people.
I bet.
Working to try to get online and book. There was about 25 minute period
I was
where
gonna say, any crash yet?
yeah, well, some people weren't able to get through right immediately. Just a sign of how much demand there is for appointments.
Yes.
But by within about 20-30 minutes, everything was up again and going smoothly. And I've been really, let's pull it up and take a look. So Zocdoc.com/vaccine is going to be your landing page. You're going to go and choose your state, Illinois, find availability. All it does is just ask you how old you are. Let's say I'm 65, so that I would be eligible. And then there's just 4 brief questions. Do you have a history of a severe reaction of, anaphylaxis to vaccines? Have you been treated with antibody therapy for COVID in the last 3 months? No. Have you had any vaccine, including flu shot, in the last 14 days? And have you been diagnosed with COVID in the last 14 days? The answer to all those is no. I submit. And it says I am eligible because I told it I was over 65. And then we click see availability. And it will bring up anything that's available. So first you see most of the sites here in Chicago, no upcoming appointments. And I know those of you who have been using this are saying, look, Holy Cross and Mount Sinai and Chicago Family Health and Erie and all these, no appointments, because they're just, they go so quickly when they come up. But look at the top here. Appointments available. Seniors only, 65 plus at the United Center. And again, only open for people over 65 and older today through Sunday at 4 p.m. And so if we click, it's actually interesting. We went ahead and opened both walk-up and drive-through appointments, and all the drive-through appointments are actually already booked up this morning. But if we click on the walk-up.
What do you mean all of the drive-through are booked up for like the whole 3-week period?
Yep. This is how quickly appointments are going. So,
all right.
Yeah, I mean, we weren't, the drive-in is not starting until the 3rd week or so.
Okay.
It wasn't the bulk of the appointments.
So it wasn't, okay,
but it is new for us to have that as an option.
Yes.
So those, when I looked at it just half an hour ago, there were still drive-through appointments, but those are now all booked. But here's what's available in terms of those walk-up appointments. And if people do need a ride, we can talk about this.
Yes.
There are free Uber rides only for Chicago residents, really only if you need it. Please, if you've got another way to get there, don't take that because they're not unlimited. But we've got about 20,000 available for Chicago residents, free to and from the United Center for the vaccine. And so we click, and it shows you, the first appointments that are available. They've got some Tuesday, March 9th. So just, what is that, 5
That's
days
less
from
than
now?
a week.
Less than a week from now. And you can see there's appointments 8:30, 8:45, 9:15, 9:45, 10. And you would basically, so there's appointments. And, we keep sort of adding these, as they come on. And there's appointments all the way through here. And if you click, you'll see they really go through, kind of through most of March is the idea. And so all you would do, like say I wanted Monday, March 22nd.
March is Support Our Seniors Month.
March is Support Our Seniors Month, that's right. And so that's why these are first open to seniors. I click on it, it then wants me to know a little bit about me, my name, my date of birth, my sex, you continue booking. That's about it. And then it'll connect you. There's some things that come afterwards. But this gets you your appointment. And we really, 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 really want you to help anybody over the age of 65 who lives, especially in Chicago, or in Illinois.
You know someone,
if you know
love someone, you live with someone over 65, we want them to take advantage of this.
We want them to take advantage of this. There are appointments right now.
Isn't it the case, Dr. Arwady, that we have vaccinated about 1 in 3 seniors in Chicago? And
That's right.
This is our opportunity to get the other 70%.
That's right. That's right. It's one of our opportunities. There's a few things that are happening. But yes, please make the appointment. In fact, one of the people who's helping with the camera here today told us that he managed to get his Zocdoc appointment booked this morning. So I love hearing this. People who have been working to get an appointment haven't been able to get one. You can get an appointment right now. Sign up for it and get yourself booked in. So
what if I don't have internet?
Yes.
Not good with the computer.
Yes, so we do have a call-in line. It is 312-746-4835, and if people want to see the details here, we can maybe just check back on the website. If you go to chai.gov/COVIDVAX, VAX, there's a lot of information here just for seniors, and there's some details here. Reminder, there is no on-site registration at the United Center, so you can't show up and try to make an appointment. You do need to make an appointment in advance. But the phone number, 312-746-4835.
And there will be no scalping of appointments outside of the United Center.
Yeah, no scalping of appointments, that's right. That also got a very big hit of calls this morning. We've got 200 of our contact tracers extra on board just helping to support this.
Yay, contact tracers.
Yes, our community-based contact tracers who we hired all along. But I know, especially early on, there were some people getting busy signals. The system can handle about 600 calls at any one moment, but keep calling. There are appointments, and we'll work to get folks in. But if you do have internet, you can do this on your phone as well. You don't need a computer. We really are encouraging people to try to use the computer where they can, but then if they can't, obviously go ahead and use the phone number.
Yeah, that's right. You can just use your smartphone.
Go
to the website on your phone, and then go through the paces.
Yes, and it's available in lots and lots of different languages. So lots of support there. Some other United Center questions. You said about what vaccine?
Yes.
Pfizer. Pfizer is the vaccine that is being given out at the United Center. You are making your first dose appointment here, and then you'll get your second dose appointment made really when you're on site and scheduled approximately 3 weeks after that first dose. That second dose would also again be at the United Center. So
let me ask you this question, because you just went through and you said you were over 65.
Yes.
What if I do that and I say I'm over 65 and I show up?
Yeah, so you have to give your date of birth, right? I didn't put all that in and sort of finish the registration. And it actually is important that people are providing the appropriate date of birth, because as a reminder, this is going into the vaccine registry, which is how we keep track of making sure the right person gets the right second dose, where, down the line, your doctor is going to want to, for example, know that you've gotten this COVID vaccine. You may need to be in a situation where you've proven that you've gotten this vaccine. All of those are reasons why we need people to be honest about their date of birth. We have worked hard to make sure that there's not a requirement for example, a federally piece of identification, but people do need to provide that date of birth. And if you're not over 65, these appointments are not open to you now. And if you try to make an appointment with a date of birth where you're not 65, you're not going to be able to keep that appointment right now.
Got it. What if I live with someone who's over 65 and I'm kind of a caretaker or supporter of that person?
Yeah, so these appointments right now are just open for people over 65. Again, older folks are the highest risk in terms of severe outcomes, hospitalization and death, like really dramatically, regardless of underlying conditions. We just have seen older folks in Chicago. Regardless of race and ethnicity, age is by far the biggest risk factor for severe outcomes. So if you're a caregiver, say you've got someone over 65 who might need a little bit of extra help, you are welcome to go with that person to the appointment. The person who's getting vaccinated can bring one person. Now, the companion does not get vaccinated, to be clear, unless they're over 65 also. But you can bring a caregiver if needed. And we've also thought about other mobility assistance, recognizing it's going to be a lot of seniors here. So, for example, there's a dedicated drop-off and pickup area for people who may have mobility issues. There's a section of the structure that's dedicated for people with mobility issues. There's wheelchairs on site, customer service attendants should that be needed. And then again, if people need to bring a companion. There's language access for non-English speakers, American Sign Language, really thinking about the various needs that people may have. And the appointments are open 7 days a week, 9 a.m. to 7 p.m.
Okay. You've answered most of Mark Conkol's questions, but here's one that I don't know if we know yet, but how long will the walk-up lines be? How early should someone arrive for an appointment?
So the lines should not be long. One of the reasons why when you schedule this, you see they're in 15-minute blocks, is that a big part of doing COVID vaccinations, different from flu, different from our typical vaccinations, is we really want to make sure that all of the appropriate social distancing is in place, et cetera. And so we have very consistently seen at our points of dispensing that people are not having to have long wait times. We are starting on the 9th, on Tuesday, with a somewhat smaller number of appointments, and that will ramp up over that first week while we make sure that our assumptions related to how many people can move through and how many people are vaccinating are accurate. But you don't need to plan to arrive significantly before your appointment. Do please try to be on time. And really, I would not anticipate that you would need to be waiting more than a pretty short amount of time. Good question, and especially if there are people, again, with mobility issues, et cetera, we would work to make sure those folks didn't need to stand and be waiting.
Okay, kind of related, I think you've already answered this, but Leonore Chin from Facebook, do you know how they will be organizing themselves at the center to ensure social distancing?
Yeah, so there's a lot of work happening on site about that, and there's all of the things that you've sort of gotten used to related to, here is spacing in terms of where you have to stand, here's how we're moving cars, here's how we're moving people, all of that.
So if you've been to Trader Joe's,
yeah,
you pretty much know.
Yeah, exactly. Yeah, but things around making sure masks are obviously required,
Yes.
and screening, symptom screening, all of this will be in place, all of the best practices. And we have learned a lot about how to do this pretty efficiently over these last few months. This will be at the biggest scale, and it will be, a lot of the folks on site are really, they're going to be federal. There's going to be folks there inside who are, from the Department of Defense, helping with vaccinating, helping move folks along. So very organized, lots of protocols, and there's a lot of planning. The physical build out is pretty much done. This isn't going to be in the United Center. That's a question we get sometimes. It's actually, there's been a series of really large kind of climate controlled tents that are outside, good for ventilation, good for moving people through, able to adjust, right, as seasons and weather and numbers of people. But it's a big operation. They've thought about parking, they've thought about how to move people. So our logistics folks are really very, very good, honestly. And they've been thinking about all the eventualities, and I'm confident that it's a huge operation, but I'm confident it'll go smoothly. When we do bring the drive-through in, that's another. They've thought about, how do the cars drive and how do they move and where do they wait for their 15 and their 30 minutes. Some of this is by later in March, we're at a point where the weather allows us to start doing this a little bit more easily. Yeah. And that's really, we're going to see how this goes and see what's popular. It's interesting to me that the drive-through appointments went first. Maybe we'll be able to open some more up of those. Our goal is to sort of look and see what are people signing up for. It's all about vaccine. That's the main thing limiting us. So,
and it's interesting how our experiences just build on each other, because I know we've done testing as drive-through and walk-up.
Exactly.
So some of these things are not new to us at this point because of what we've done before. Okay, we have a couple of more United Center questions. Sue Jong from Facebook, I was able to secure dose 1 appointment at United Center. Will dose 2 appointments be made when I show up for the dose 1 appointment?
Yeah, so the way that it works is we want to make sure that we are making a second dose appointment for people who actually come and get their first dose. We expect, of course, everybody to come and get their first dose. And so when you come in the waiting period, after you get your vaccine, there's a waiting period of at least 15 minutes, in some cases 30 minutes. And during that time, again, socially distanced, very safe from a COVID perspective, but there are folks there who will be helping you get that second appointment scheduled. So we always, and this isn't just a United Center thing, always in the city of Chicago, we get so many requests for vaccine, right? Like that we could be doing easily 3 to 4 to 5 times probably the amount of vaccinations that we were doing if we had more vaccine. So every week the team is kind of sorting through all of the requests from all of the providers, from all of the sites. The very first requests that we fill every single week are second doses. We look and see how many doses did this site give, 3 weeks ago for Pfizer, 4 weeks ago for Moderna? We send exactly that number of second doses so that every site has available all the second doses we need. So always in Chicago, we've worked really hard, and we control our inventory and sort of what we give out to make sure we can always meet those second doses. So that will also be true at the United Center. Really, if you think about it, the reason we opened up about 3 weeks of appointments is that will be the first dose, and then there will be about 3 weeks of primarily focused on second doses,
right.
And then we'll assess after there. 6 weeks from now, we're going to be in a really different spot, I think, related to how much vaccine we have, where the needs are. But yes, you'll get that second appointment. It'll be at the United Center. It'll be a second dose of Pfizer. And again, we've learned a lot about how to do that efficiently, and there will be folks on site to help people make that appointment. You don't need access to technology, et cetera.
Here's a question from Faith State. Doctor, do you know how many people are scheduled for each time slot?
Oh, that is a good question. I do not know the answer to that off the top of my head. I think it depends a little bit on how many vaccinators there are. So it takes a lot more people to run a site than just the people who are putting vaccines in arms. My understanding off the top of my head is that there would be a maximum of about 80 vaccinators at a time. And so if you can set it up so that folks are kind of moving through, that would probably be the max that you'd be setting up. But we've done some time studies and some analysis around, again, how quickly we expect people to move. Now, some of them could be in the on-site versus the drive-through. There's some division there. Yeah. But we set the number of appointments that we know that we'll be able to handle, where people won't have long lines, and where we'll be able to have all of that really safe social distancing.
All right.
And I will follow up on that, because my logistics team will like that question. They will know it, like down to the minute.
we depend on Faye for yes. Great stumpers. Kevin Drafts from Facebook, when will 1C be eligible for the United Center?
Okay, so there's multiple points to that question.
Yeah.
So first of all, let's talk about the United Center first. So right now, at this moment, you can and should make an appointment at the United Center if you live in Illinois and you are over 65 and older. Sunday at 4 o'clock, if there are still United Center appointments available, they will then open to people in what Illinois considers 1B+. People who live anywhere in Illinois. So, as always, we want to make sure all appointments are being used, et cetera. So if you have an underlying condition, as has been defined by the state of Illinois, if there are still appointments available, Sunday at 4 is when you would be eligible to make those appointments. And that's true for anybody who lives anywhere in Illinois as well, just to be clear. 1C, which, just as a reminder, the CDC, really everybody has defined 1A, 1B, 1C. 1A, healthcare workers, long-term care. 1B, what we're in right now, people in Illinois 65 and over, as well as a very specific type of frontline essential workers in the highest risk. The first responders, the grocery stores, the transit, manufacturing, and we've been slowly, teachers, we've been rolling kind of through those while we work on getting seniors. 1C is when you actually bring in people who are 16 and over with underlying conditions, as well as the other essential workers.
Yes.
Okay? So Illinois, in parts of the state that have available vaccine, have added this 1B+, which is not the essential worker piece, it's the people with the underlying conditions. At this moment, we have not said formally when for sure we'll be able to move into 1C. I do think things are actually reasonably on track with what we had assessed here, where we had made a guess,
kind of
really. We projected based on what we thought vaccine would look like, that March 29th, that last Monday in March, might be when we would be able to move into 1C. And I actually think things are reasonably aligned with that. The hope is that if more and more vaccine can get here, maybe we would do that 1B+, for example, in that same way, a little bit later in March here. So when we moved from 1A to 1B, we had, if you might recall, our existing healthcare providers, we had them, if they didn't have healthcare workers to vaccinate, go ahead and start vaccinating their existing highest risk older patients.
Yes.
We will likely do something like this in March, a little, probably relatively soon. We'll see. Well, we're going to see what these numbers look like. We probably would do the same thing where perhaps in mid-March we would similarly open up to providers, start with your highest risk patients who are under 65 with those underlying conditions. We've not made a specific determination on that date because so many things are in flux related to how much vaccine we're getting, as well as what demand is like. So this United Center that opened today is part of that question, and seeing whether we have appointments that go unused. We know not everybody will choose to get vaccinated in a way like this, which is why we continue to work on strike teams. We continue to bring vaccination to all of the senior centers. We've done all the long-term care, all the assisted living. We've done well over 90 other senior facilities. We've been getting to all the CHA buildings. There's actually, the team was telling me yesterday, somewhere in the vicinity of like 780 congregate facilities that have sort of registered online. Wow. They've been working through them. And we're through about 90% in terms of assessing, not in terms of getting them all vaccinated, but getting them scheduled for some of these strike teams. And again, it's all just dependent on vaccine. Yeah. It's not really about capacity, it's about how much vaccine. And especially the Moderna vaccine is just not, we're not getting that much of it. And where you're talking about less than 4,000 doses a day to go across the entire city. That's the vaccine that we use, for our outpatient settings. It's what we use for CPS. It's what we're using for CTA. It's what we're using for Protect Chicago Plus. Right. There's just not a whole lot of vaccine. So we've just gotten the first J&J vaccine. People may have questions there. We can talk about. Actually, we should talk about that and homebound seniors in a second. But we don't have a sense yet, is that coming continuously? What is that looking like? So it's sort of a moment of flux. The major focus right now, seniors, make sure all the seniors get vaccinated. And then just as soon as we're able to, we will move ahead toward sort of maybe a 1B plus versus just a full-on 1C.
All right. So let's transition from the United Center questions to homebound seniors.
Okay, good.
Because there are some folks who might not be able to get themselves to the United Center.
Yeah.
But before we do that, I will say I got a little news flash here.
Okay.
So far, 13,000 appointments have been made at the United Center. So
in just a couple hours.
Yes, in a couple hours. So on a good clip there. So what if you are a senior?
Yes.
And so this is your turn, but you really cannot manage getting out of the house.
Yeah, absolutely. So this is the other big thing that is actually launching today in terms of a new initiative. So we did today start with a program for seniors, and then after that, people with disabilities who are truly homebound. And that is actually where we are so excited to have the Johnson & Johnson vaccine, a single dose vaccine, because if we think about Homebound, this is in partnership with the Chicago Fire Department. It is at least how we're starting in the pilot. They've got teams that are going out, bringing vaccine, to folks who really, it's very, very hard for them to leave home. I'm going to show you the form in a second and how you can let folks know and who's eligible. But they're vaccinating not only the person, but everybody else who lives in the household, or anybody who's providing hands-on care. Because if you think about it, the homebound person can't really leave the house. So, more of the risk is related to people coming and going, which is why we started with home health aides and people who, are going in and providing care to these settings has the biggest impact in terms of protecting folks. But we are launching this. It's really time intensive, right? Like you've got to go in, you're doing one vaccine or a set for the household. You've still got to do that 15 or 30 minute wait period. So having the single vaccine there is really exciting. Let's show people where this is. So we're back on the website here, chi.gov/COVIDVax. Under Chicagoans, there's a whole section here at the bottom for seniors. And so right here at the top, seniors and people with disabilities who are homebound. Oh. We're starting a program for in-home vaccination. Seniors who are not homebound need to pursue vaccination through other means. And it's being provided by uniformed Chicago Fire Department community paramedics who can produce identification. Important where you think about letting someone into your home or not having scams, et cetera. Yeah. These are folks in uniform who can provide identification. If you click here, it will actually bring you to the form. Get it to load, and highlighting really who is eligible for this vaccination. I wonder if this has, there we go. So it highlights here, to be eligible for this program, you must be a senior or a person with a disability who requires in-home assistance, or you have to use adaptive equipment like a ventilator, crutches, walker, wheelchair, etc., and really need to use accessible transportation to leave home. And leaving home is not an option for you because doing so requires considerable and taxing effort. So this is especially focused for people who it's really hard for them to leave, even to go to a doctor's appointment, right?
Yeah.
Like even with extra support. This is not going to be the fastest way to be vaccinated. So let me just highlight that if you've got another option, we do want people to use this, to use the other option. But if you fit these criteria, you basically fill out this form. You have to attest that you meet eligibility as defined. You have to give your name and your address and some details. How do you want to be contacted? Because this needs to be an individual conversation. Some date of birth, some stuff about your language, and then what is the are you a person who has a disability of some kind? Are you deaf? Are you blind? What are the issues, so we can make sure to provide things on site, and then more information about accommodations you might need. People can fill this out on behalf of someone, but then you need to give your contact information as well. And there's information if there's power of attorneys and some of that. And then you put here how many people age 18 and older who live in the home, including the homebound individual, any other comments, and you submit. I expect to get a lot of these probably, so I would ask people, again, some patience here. If you've got another way to get vaccinated, please pursue that. We will be starting with seniors, again, consistent with the prioritization on getting folks over 65 vaccinated. That is likely to be our focus really through March. And then opening it up likely after that to people with disabilities. As always, we will see what supply and demand look like. It's literally launching today for the first time, so there will be lessons learned here, I'm sure. We'll be looking to scale up as is necessary. But that was really, that's exciting, and another good option. Yeah.
Yeah.
The other way, Johnson & Johnson, today we've started using it out at O'Hare for some of those transportation kind of airport-focused essential workers who are in 1B, haven't yet been able to access vaccine. We're also launching some of the manufacturing work, some of this more employer-based work, and really excited to have another vaccine available.
That's great. Okay, we have like 5 minutes left, so I'm going to try to find some quick ones. Hopi Miranda from Facebook. I heard if you have blood type O, you don't have to get the COVID vaccine. Is this true?
No, you should get the COVID vaccine regardless of what blood type you have. If you have blood type O, that means you are a universal donor. You are, the American Red Cross and others are most pleased to get your blood because it can be used for others, but there is no high-level protection that any blood type gives, and you definitely should get the vaccine regardless of your blood type.
Okay, and then at the NO Now from Twitter, is hypertension one of the heart conditions that will qualify a person for vaccination in phase 1B+?
Yes. If you have it's a little bit vague, I think on purpose. I would refer you to the Illinois website if you want to see some of those details. But generally, people who have underlying conditions, cardiovascular disease, can be included in that.
Okay. Don Wolf from Facebook. How should Chicagoans handle St. Patrick's Day? That might be a good question to end on. Don.
A good question to end on. So let me start by saying I was pleased to note that St. Patrick's Day is in the middle of the week this year, just in terms of, we are not at a point where we can start having major St. Patrick's Day celebrations. We are just not. I should have noted right up at the top here, actually. Today is March 4th, and if you look at our dashboard, like I do every single day, March 4th, 2020 is actually when
where it all began?
Our dashboard starts. Yeah, we had a couple of cases earlier than that, if you remember, those very early, late January travel-related cases, et cetera. But really, a year ago, March 4th is when we started. That's when our dashboard starts, and that's when numbers really kicked up. And so
the parade was canceled.
It was canceled, and so that's what's reminding me of it. So that it was really this, as we were getting into March, this very compressed time period, kind of leading into St. Patrick's Day, where we were starting to see some more cases. And I think in a lot of ways, canceling the St. Patrick's Day parade was one of the first big things that people started recognizing that this was going to be a major impact.
Action.
Yeah, exactly. And so I have strong memories around St. Patrick's Day is the point. But, we are in a much better place than we were a few months ago, right? You saw we were able to expand bars and restaurants to 50% capacity, some expanded hours there, but we've got to keep the COVID precautions in place. And I would just ask people, not the year yet for a big celebration. I'm very hopeful that, in a few months, if things keep heading the way that they're going, we are going to be sort of more and more open. We're certainly having conversations about later in the spring and the summer, and if things keep heading the way that they're heading. But the middle of March is not yet a point to sort of think that COVID is just over. And that includes, say you've gotten one COVID vaccine and you're sort of feeling good.
Yeah, I was going to ask, because because we've been in 1B and even 1A, right? We've gone through these work settings. So you have coworkers, who might be like, oh yeah, you got vaxxed, I got vaxxed, let's hang out.
Yeah, and I think, the risk, if there are two people who are fully vaccinated, they are both 2 weeks post their second vaccine, or their only vaccine if it's J&J, the risk between those two individuals is very low. It's not zero, but it's very low. But as you start to add people in, particularly if you're sort of doing this in public settings, et cetera, that just becomes less and less controlled. And so, I really think about, and we still are only although we're at 1 in 8 people who have gotten at least that first dose of vaccine, I think we're at, less than 7% of the city has gotten both vaccines. So we're not even at 10% of the city, right? And we're just not at a point, and we're not even in a lower risk category in terms of number of cases. If you're gonna be out, please just wear the mask, keep practicing caution, and we are, the risk gets lower with every additional person who gets vaccinated. So that's one of the things we're looking at. We're looking at case numbers, we're looking at vaccination rates, and
we also kind of defeat those variants if we stop the spread.
Very much,
right?
Very much, exactly. Yeah, the variants are
to keep our guard up.
Variants are the biggest concern in a lot of ways. Like if some of these more concerning variants had not emerged, I think there would be less uncertainty about sort of the future. But although all of the variants that we are using here in the U.S. do have protection against all of the variants, I think it's important
all the vaccines that we're using.
All of the vaccines that we're using have protection against all of the variants. Thank you. We have seen some lesser protection against some of those variants, particularly the variant that had emerged or was identified in South Africa. And getting a lot of people vaccinated now, here in Chicago, not waiting for another vaccine or waiting down the line, really getting that vaccine when you have the opportunity now helps protect you, but it also helps protect everybody against the spread of variants.
Yeah. Speaking of where it all began, it would be interesting to get another one of those, how we had the visualization with all the dots and they were turning?
Yes.
It would be so interesting to see that visualization in this context.
The blue dot?
With people getting, some people getting vaccinated and some people not.
Yeah, we could.
Who are those folks who did that?
Yeah, we could pull some of that back maybe. It's really been. I will tell you, for the team at the Chicago Department of Public Health, particularly the team that goes into these outbreak settings, it's been so striking to be in, a facility that has an outbreak going on, and to realize that literally all of the people who are getting COVID are the people who did not choose to get vaccinated, right? And that we have this new tool, and it's about just building that confidence, particularly in high-risk settings, high-risk buildings, higher risk communities, and that it's this mix. Right now it's people, it's hard, people, there's so much around like, how can I get the vaccine? How can I get the vaccine? It feels like the demand is very high, but I think it's gonna not be that long before we've got a lot more supply, and it is gonna be more around making sure we keep building that confidence. And that's why, I like getting questions like blood type or questions, concerns, because I want people to feel confident in taking this vaccine. And kind of doing your part to protect yourself and protect Chicago.
All right. Any good news you want to squeeze in here?
I think we had a lot of good news. Otherwise, what have we got here? So, happy birthday to Chicago. The city was formally founded 185 years ago, but it traces back even further than that. And I think just other than that, I think the opening of the United Center and the fact that we've already got, whatever it is, 13,000 people signed up for appointments. Thank you to those 13,000 people who probably have been quite anxious to get a vaccine up till now. I'm glad that we're able to ease some of that worry for you. And just again, my biggest ask to everybody, if you know anybody over 65, even if you just have a neighbor, somebody you don't know that well, somebody at your church, somebody at your synagogue, someone in your family, just reach out, have a conversation. Have you gotten vaccinated? Can I help you sign up? There's vaccine here. I'd really, really like to see these appointments filled by the people where it'll make the most difference in terms of us getting past COVID.
Yeah, so again, if you know a senior, love a senior, like a senior, live with a senior,
Yep.
This is the time to get in there online or with that phone number.
Yeah.
It's really exciting.
It is.
All right, so hey, what else is there to say, Dr. Arwady?
I think that was a lot to say for the day. So thank you for everybody who's been putting your questions in. We will be back on Tuesday answering questions live. In the meantime, if we don't get to them, we are continuing really every single day. We update that website, chi.gov/COVIDVax. Lots of questions, lots of answers, lots of details, and a lot about some of these logistics of how to get the vaccine. So we're doing everything we can to get this vaccine to you as quickly as we possibly can, and hoping that it's going to be more and more and more better news related to vaccine supply as each week goes on.
All right. Have a good weekend. We'll see you back on Tuesday.
Yes.